Hi, I'm Anthony Gerber. I'm a professor of medicine at National Jewish Health in Denver, Colorado. I'm also chair of the Colorado Air Quality Control Commission. And I want to share some of my thoughts about the air pollution crisis we're having on the West Coast, seemingly on an annual basis. As I think many of you know, global warming is promoting unprecedented wildfires on the western part of the U.S. The last several years, we've had really terrible air quality across the western coast, including times when Denver, where I live, has had the worst air quality in the world. For a lot of people who are active and like to exercise, this creates a couple of problems. First, what can we do about the problem, this global problem of air pollution? And second, what are the health impacts? Am I going to harm myself by exercising when it's bad air quality? That problem wasn't as big an issue before these intense wildfire seasons, because maybe you could have 2 or 3 days when the air quality was bad and say, this will be a day I don't exercise. But now we're faced with weeks on end of what we know is poor air quality. And it really brings up the question as to, should I exercise outside when the air is bad? Should I do the things I love in the outside over the summer, or should I find other activities? And the answer is we don't know for certain. We do know that if you're vulnerable, if you have asthma or lung disease, that those exposures to wildfire smoke might drive exacerbations of those illnesses. And we discourage people who notice symptoms such as shortness of breath in association with wildfire pollution or other pollution from exercising on days when the air quality is bad. For many other people, they might notice their eyes burn or their nose burns and be bothered by the smell of smoke or pollution, but they don't really have major symptoms. In general, we think that short-term exposures don't do a lot of damage in the long term to people's lungs. The question about exercising for weeks on end when the air pollution is high is not really answered. We know that some people are likely more predisposed genetically to develop lung disease in association with pollution, but we just don't know which those people are. So I can't tell any of the people listening to this if they're the person out of 100 people who's going to have a problem with lung disease from exercising for consistently in times of bad air quality. Moving from the health issues, which are real and need further research, to what can we do about it? I think that global warming and climate change in relation to greenhouse gas emissions is a really hard problem for us to address as a society. We are really dependent on fossil fuels for much of what we do, for heating our homes, for driving our cars. Our infrastructure, and indeed much of our economic system and planning has been set up around our use of these fuels. No one person can change the trajectory of climate change, but it's incumbent upon each of us to spread the alarm. If you like to exercise outside and you're worried about wildfire smoke, we need to tell people that this is being driven by climate change. We need to try and do our little part, which I think there's two parts to that. The first is, if we can minimize our own footprint for global warming, climate change, by reducing greenhouse gas emissions, that's great. There are some things people can do which they might not think about. For example, a lot of lawn and garden equipment is really highly polluting, and many good electric models are available. So that's sort of a small thing that you might not think about you can do personally. On a bigger level, I think we can encourage our local, state, and federal leaders to take this seriously. It is a global problem, but if we can't solve this in the US and do our part, we are the richest and most powerful nation on the face of the planet. We have a lifestyle that up until 50 or 60 years ago would have been inconceivable for most of humanity. And if we can't put our foot forward and solve this problem, despite the challenges associated with changing our economic system and changing the way we do business, who can we expect to solve the problem? So I would leave you with a couple of messages. The first is that there are real health and lung effects of air pollution, particularly on the elderly, the very young, and people with lung disease. I think long-term exposure to really bad air quality is a potential risk for otherwise healthy people. We need to learn more about that. And to solve this problem, generally, we need to all do our part individually, locally, federally, and on an international level to reduce the emissions which are driving climate change and causing wildfires that impact all of our health. Thanks very much for your attention.